Well, some of the things that I was going to mention, they're already mentioned, and this is a little bit the outline of the presentation that I'm going to be sharing with you, with a more focus in what we are doing in Mexico. Well, this is already been mentioned. Upper middle income countries share the largest proportion of the epidemic obesity. In Mexico, Latin America is also moving upward in different fashions. We heard the data from Colombia and Brazil already from Barry, and here you can see the Mexican data that they also show a very rapid increase in obesity for boys and for teenagers. Now, what we have heard in the previous presentation shows that in high-income countries, obesity increases, and then after it reaches a certain income level, it starts going down. And beyond, what we see is that beyond a certain point, people start getting better off and get control. And we believe this is because we have healthy behavior, access to healthy food, or more active environments. In the US, for example, it's claimed that knowledge and access to healthy food and behavior is an enabling, health-enabling environments among high socioeconomic groups explains this inverse association between high socioeconomic status and obesity. However, in low income or middle income countries, we see a different thing. We see really that obese is more related to high socioeconomic, and this is probably due to the adoption of sedentary lifestyles or access to highly processed food, which is more culturally appealing. So we see that in some countries that as development goes forward, there is also a decline in this association between obesity and high socioeconomic. And for example, Israel is one of those examples. But these observations suggest that if we do develop adequate policies, people who are better off could be protected in time to reach these high levels of obesity. So we think we might have a window of opportunity. Let me show you just some data that they haven't been mentioned until now, which is China. Here is the increase in obesity if the parents are part of the bureaucratic elite. Here is the father part of bureaucratic elite, and here's the mother part of the bureaucratic elite and non-being part. So they start almost at the same time in 1991, but there are dramatic increases which are linked to high socioeconomic status, in this case represented as the father or the mother being part of the bureaucratic elite. In Mexico, we don't see those big trends linked to socioeconomic status. Here in this graph, you can see the data stratified by quintile of income, and here you see the obesity trends for children 5 years old or less. We see that there's a slightly increase probably for 2012, but we don't see a pattern like the one we see, for example, in China. In adolescents, however, we see a smaller trend with the lowest quintile being at lower levels, but showing the higher proportional increases from 1999 in the blue to 2012, sorry, in the green line. So you can see this big increase. While in the highest quintile, we see that they've been stable, or if you want to be very optimistic, you might be looking at a small decline, but not for sure.